On behalf of the Social Democrats, I'd like to move the motion on the cost of cancer care. I also have to say that it's disappointing that the Minister for Health isn't here to listen to this. Cancer care is a huge element of the health service, and it really is quite disappointing that he's not present here. There's not in the country and he's off some business event, and that's a pity. With the agreement of the House, I wish to share my time with Deputies Whitmore and Gannon. Every 3 minutes in Ireland, someone receives a cancer diagnosis. Sitting in doctors' offices up and down the country, across every village, town and city, it's a largely indiscriminate disease. Many patients say that the minute they hear the word cancer, it feels like their whole world has been turned upside down, like they're losing control. Most of us at one point or another have thought about and worried about receiving this life-changing diagnosis. But most people haven't thought about the costs associated with that diagnosis. And the reason for that is because they shouldn't have to. But the reality is that a cancer diagnosis comes with a hefty bill, with some patients facing financial crisis alongside their treatment. In a 2019 Irish Cancer Society survey into the experiences of cancer patients and survivors, one participant described it as, I quote, "like a bomb went off. It cost a lot of money and has left me weak and in need of financial assistance." Another said, "I'm just 17 days into being diagnosed. It's complete turmoil, and as it goes on, the financial burden is sinking in." This survey is filled with harrowing testimonies which paint a shameful picture, leaving you with no doubt that the state is failing cancer patients in many ways. The myriad of expenses, which are often unexpected, can at times feel endless. Medication, GP visits, specialist dressings, travel, wigs and additional dental care, to name but a few. For the patients who do not meet the strict medical card income limits or cannot afford private health insurance, the financial strain is even greater. They are essentially left adrift with no financial support at a time when their physical and psychological energy reserves are low. As a 2018 report into health inequalities in Europe put it, these are the patients stuck in the twilight zone of the Irish health service. They're at the sharp end of a two-tier health system, incurring €80 inpatient charges per hospital visit. While this is capped at a maximum of €800 per year, it should be noted that a high proportion of patients end up paying the maximum rate as their course of chemotherapy or radiotherapy requires more than 10 visits a year. And for many patients, their first introduction to these inpatient charges is often upon receipt of an invoice. Understandably enough, some newly diagnosed cancer patients are not even aware that these charges exist. They assume that their treatment is free, particularly the day services. Last year, one woman told the Irish Cancer Society that she found out about the inpatient charge the morning of her first chemo session. Imagine learning about this unexpected cost just before your first chemo session, as if you wouldn't be frightened and stressed enough already. But for many people, it's the speed with which bills, reminders, and even debt collector letters are issued that really distresses them. Invoices often come through the door while patients are still recovering from the treatment that they are being billed for. In one case, a patient received 19 separate correspondences from the hospital and debt collection agency. It's quite remarkable how efficient the health service can be when it's owed money. The practice of hiring debt collectors is especially disgraceful in my view. It is meant to intimidate patients who, with everything else going on in their lives during treatment, may just not have got around to paying. Or maybe they just don't have the money. Or maybe they're waiting for the outcome of their medical card application. Frankly, the reason doesn't really matter, Minister. What matters is the absolute lack of sensitivity and understanding being shown to cancer patients. One cancer patient described the debt collector's relentless pursuit as bullying. She was told that if she didn't pay up, her name would be blacklisted for things like car loans or home loans or even mobile phone contracts. And instead of winding down this deplorable practice, it appears that the HSE has actually intensified its pursuit of patients. It spent more than €4 million on debt collection agencies in the 7 years up to 2020. On top of this, many HSE-run hospitals are still charging exorbitant fees in their car parks, with the average cost of car parking for cancer patients at around €62 a week. Despite a programme for government commitment to introduce a cap on hospital car parking charges and to introduce flexible passes where possible, nothing has really changed. The Department of Health has failed to grasp this nettle after years of empty promises. Following a 2018 review of car parking charges, the HSE signed off on a plan to cap car parking charges at €10. The plan was signed off by the HSE Directorate in January 2019, yet many hospitals are still not complying. One hospital, for example, Our Lady of Lourdes in Drogheda, charges up to €25 a day, and there are many others doing similar. In total, this blatant money-making exercise amounts to around €12 million a year in income at HSE-run hospitals. These car parking charges are especially high in urban areas, where our 8 designated cancer centres for individual cancer types are located. These centres are located in Dublin, Cork, Waterford, Galway and Limerick. Many of these hospitals, of course, are known as voluntary hospitals. They are public hospitals, but they have the title voluntary hospitals. And they have commercial private car parks which they operate as substantial money spinners and which place a heavy financial burden on patients. For those living outside of these counties, of course, the costs associated with their appointments are even more substantial. When you include travel, parking, food, accommodation and items such as tolls and car servicing, the average cost is €989 per year. For so many people, this is the final straw. Instead of focusing on their well-being, treatment and recovery, patients are worried about money. They shouldn't be. These extra and unnecessary charges are taking a considerable toll on cancer patients and their families. We cannot stand by and allow them to continue any longer. While this motion is not a silver bullet, it is an important start. We all know that abolishing inpatient charges for cancer patients and placing a cap on car parking charges is the very minimum that must be done. Of course, the only way to fundamentally tackle the considerable financial challenges faced by cancer patients, and indeed all patients, is a system of universal health care based on need and not ability to pay. But without real political leadership and a commitment to radically scaling up implementation of Sláinte Care, we will continue to have to plaster over the cracks in our health service. With the stroke of a pen, Minister, you could change that, or at least your senior minister could, allowing cancer patients the opportunity to focus on their health and not on their mounting debts. It's time to accelerate reform of our health service, to view it as an essential public service and remove the cost barriers for patients. The Social Democrats believe that this motion would be a good place to start, to make our health service more conscious of and more sensitive to the difficult circumstances that patients are in, to make it more empathetic. So, Minister, by removing inpatient charges for cancer patients, by ending the practice of hiring debt collectors, and by capping car parking charges, cancer patients can be relieved of some of the financial worries and concentrate on their energies on getting well. It's the least they deserve and the very least that the government should do. Please support this motion.